So, good morning, everyone, and karibuni sana to this second meeting of the Kenya Healthcare Foundation. We hope the last 2 weeks have been very eventful for you guys and successful as it has for us at the Secretariat. So we will have a we'll have a 2-hour meeting, and I will be your moderator, and the chair will take the main updates of the federation. We will also have our candidates for the 2021 elections, present themselves and talk about their case. And also we will provide an update on the engagements that we've had over the last 2 months. And also we will tell you what are the events and activities that are upcoming, and AOB and any other business. In between, after the chair opening remarks, we will have a presentation by Stanbic. We have long-term collaboration with the Stanbic, and they will, Pauline Bayer, who is the head of the Stanbic Foundation, will talk about that. It's coming up in the next, between June and December. And then after that, we will also go to any other business and question and answer. So karibuni sana, and at this juncture, I'd like to invite our chair, Dr. Amit Thaka, to take it up. Amit, over to you. Thank you.
Thank you, Anastasia, and thank you, members. Let's move on with the slides. If there is a slide controller, just to move to the next slides, if you have anything. Okay, that's clear. Know the rules next. If you want to move to, okay, so this is really my welcome remarks. Let me just say that what a delight it is. I'm really very happy. This is the last members meeting that I'll be chairing. I'll really miss it. I've had this amazing engagements with so many members and so many of the organizations, but also with Ministry of Health, Council of Governors, Development Partners, faith-based organizations, CSO. And today it gives me great pleasure that organizations like us can have a fair and transparent election, and we can have a transition that we can be absolutely proud about. Finishing my 2 terms, at the next meeting in the month of May at the AGM, we will have a new, more vibrant leadership that will be drawn out from the healthcare industry in Kenya that will manage the process forward. There are a few people that will in the board remain. I've had a great time working with the management. We are very lean, and recently with the CEO coming on board, the transformation has been surreal. Leah and Anastasia are holding fort at the management office in a very delightful way. The board of directors that I have with the federation at the moment is extremely knowledgeable, and we have held each other's back in many of the advocacy engagements through the year. So from the onset, let me just say it's been a delight. I've had a real pleasure of transforming in-person to virtual membership meetings with high level of participation from everyone. We had one in-person meeting last time, which was really good, but the agility that KHF now has, it is able to move from in-person to online very swiftly without losing the quality of our work. I want to say that today's meeting is it really makes me proud, because we will have some amazing candidates that are going to talk to us about the different positions that they have been able to nominate or get nominated for. This is really a great moment for us. But at the same time, it's been so busy, I can't imagine a much busier time for us for advocacy since the pandemic. And every month and every other engagement with the ministry brings in more urgent and pressing matters. And I think that health sector is going to remain in the forefront on trying to save lives and livelihoods for the next few years. So as members of the Federation, you all are doing some amazing work. in whichever subsector you're in. Please keep it up and ensure that we are battle this pandemic together. It's through togetherness that we are actually saving many, many more lives. This togetherness is what Kenya Healthcare Federation fosters. This togetherness is what makes us different. And it's this togetherness that allows us to have a unified voice which is recognized across the national government and county governments. With those few remarks, let me please pass it back to our moderator for the meeting, Anastasia. Thank you.
Thank you, Amit, for those insightful presentation. Next is Stanbic. I don't know whether Esther is on board yet. Okay, as we wait for Esther to come on board, I think we can progress to the next agenda item. Leah, just flip the slides. I will come on board after we've finished. Yes, so we can, Amit, back to you to talk about the next topic.
So I want to say thank you to Stanbic when they join us, and I want members to see how we are actually spreading our network beyond healthcare to banking, to other industries like telecom, and it's going to be what you call the integrated approach of health sector with other sectors. So I'm really delighted, and I want to thank Stanbic right from the onset about them stepping up to save more lives and livelihoods through KHF partnership. Well done. And this is all done when they present on their CSR level. Let's move to the next slide, and we're going to go quickly through this 1, 2, 3, 4, 5 slides. We have very many new members. I like the fact that we are attracting digital members. We are attracting people who have started outside Africa and are now putting in money into the Kenyan space. Take Elephant, for example, they are creating jobs. Not only do they have funding coming from outside, but those shareholders are setting up companies beyond eight. We have local distributors who are now on the front line of increasing vaccines so that we reach herd immunity like Sai. We have emergency medical services. We have a group of hospitals under one of the largest footprint in Kenya, which is called Evercare. So I'm delighted that we're getting like-minded people, people who are going to actually shape the private sector footprint on this country. Next. So I want to thank them and want to recognize them if they're here. ARC is knowledge. Stanbic has also joined as a member. Think Well, Zawadi, Ponea Health, Harry, Pract Health. All these are, again, homegrown companies like Ponea who are going to give us some interesting solutions. So let me just not mention all, but thank all of them. Are there some more? I want to thank them, and I want to say that we're doing something right. You members who've been with KHF from the beginning, you've been doing something right for this country to attract these new members who are joining now. Advocacy. Wow, this has kept us busy, really on our toes. And the phones have been ringing, meetings have been held, and we've been having people like Anastasia crisscrossing counties to make really a difference. So, like you all know, that vaccine hesitancy was the big thing. And the uptake in our country was so low, up to 2,000, 3,000 a day, and it scaled up to 40,000 a day at one point. This is what has been touted as the seventh on the global leaderboard. It's the trajectory that Kenya was able to do, maybe a 20-fold leap on reaching out to lots of people. We came on the forefront on the early days. As you can see, some of our directors took the first dose. So thank you to all the directors leading by example as health workers. Next. Vaccine issue has been quite tight. As you know, that five of us are now in the technical working committee appointed by the PS, Ministry of Health, to quickly design a 2 week quickly design something within the next 2 weeks, which will be known as the Kenya Framework to enable private sector play its role in importation, in storage, administration, logistics, and eventually um, record keeping. And the background was that we don't have enough vaccines coming in. We all know there is a problem. The current landscape was that COVAX over reliance is going to be a major issue because you've also seen what's happening in India. There was hesitancy and confusion, which, by the way, we've done very well because almost 1 million people will be vaccinated in the next 2 to 3 days. The visionary roadmap we were trying and we've been trying to push is the Vaccines for All initiative. Impatience of those below 58 who are not frontline workers is extremely high in our country. And then the role of the private sector became a little bit mucky, as you know, with that 2nd April ban being imposed on the 75,000 doses of vaccines that our members have, in good faith, tried to bring in and create a more wider cover of vaccines. So, what did we do? So, this was the background. In the next slide, it will show you the, the, the main 4 areas that we presented to the technical working committee. So if we can move to the next slide. In this slide, it shows you clearly what we as KHF, with your interest and your skills, put together onto the technical working committee. We are at our first draft. The second draft and the final draft will be ready. Hopefully by Wednesday, Thursday, we will present it to the CS, who will take it to the NERC, and will have a clear framework of how private sector will play a role. We talked about the administration of inoculations. And I would like you all here to literally give a round of applause to all the private sector hospitals who have played an amazing role to give vaccinations to the people of Kenya at no fee. They did this totally as CSR, and it's reported that at least 1/3 of the people who received the Kenyan government vaccines went ahead and provided this protection. I am really proud. We all as members should be very proud. And wherever you are, just give them a big round of applause for the superb work that they have done with their health workers. We want to carry on that as our first offer in the technical working group. But now, for sustainability, when we need to reach 30, 40, 50 million Kenyans, I think a discussion of a dispensing fee for our members is a fair ask. It's around 200 to 300 shillings maybe per person, and it may cover their payroll costs and other costs. The second we talked about matter was around logistics and distribution. And there are quite a few members who've come forward and shown us the cold rooms that they have and the logistics that they possess. And that kind of logistics and distribution are that is what we have presented to the committee. Cold room, in addition to the depots of government, are going to be considered to be utilized. And when you have the ability to move vaccines very swiftly in remote areas, that will also be within the framework. Let's talk about ICT and administrative support. We started giving many ideas about different ICT support, but it's clear that the Chanjo system, though it had a shaky start, it's now much stronger, more robust. Many of you who did not get SMS on the time of receiving your vaccine should have received your SMS because of the backlog entry by the data clerks. Not only is the SMS system more robust, but the daily report system on the vaccine is something to be proud of. Have a look at the Ministry of Health website homepage, and you will see transparency on every vaccine from where it has been picked up to where it has gone and how it has been administered. It also shows us that about 27% of the people who have received vaccines don't fall into the eligibility criteria. They are below 58 and they are none of the front line. And we have seen this called jumping the queue syndrome that has happened in Kenya. The final thing we talked about was the policy framework review. And once the framework is in its final stages, we will share it with the members. Yesterday or the day before, we started talking about the possibility of manufacturing, fill and finish, and the sense of urgency to engage the Federation of Pharmaceutical Manufacturers to literally scale them up with rapid speed is something that the MOH is keen. Anastasia will invite you for engagement meeting, and we will have a clean engagement with the Federation of Pharmaceutical Manufacturers. The other matter of urgency that has come to us is oxygen. And it has been noted that steel factories are offering free oxygen and telling people to bring cylinders into their factories to fill them up free of charge. And many of the cylinders belong to our members. And not only are they up in arms about the illegality of this, but also concerned about the quality of oxygen being administered to Kenyans through hospitals just because they are in dire need. I'm sure it is being done out of good faith. They have an intention of pushing oxygen out, but we are meeting on Monday with the stakeholders, the hospitals, and the oxygen providers and the regulators to find a solution to this problem being brought into Kenya that we have seen is being also dealt with in many parts of the world where oxygen is in high demand, like in India. So we do need to have this medical oxygen to be pure, and this industrial oxygen may have its complications. So those are the two things besides the vaccine distribution we are dealing with right now in this committee: oxygen and also vaccine manufacturing. Next, on advocacy. These are the members on the technical working committee that meet every Wednesday. Our mandate is to make sure that the framework is aligned and in unison. We did bring up the Sputnik issue. We were a little bit upset that private sector was being painted in a light of a total non-administrative and non-compliant way. It was clarified that the quality of the Sputnik was not in any doubt. The intention was also appreciated, but what the ministry is more concerned about, that there should be nobody selling vaccines. This idea of retail sales and those who have money get it. And more than that, people took advantage of the vaccines being sold so that the counterfeit vaccines were totally getting out of hand, and people took advantage. So I think that is what the ministry currently is battling with. So no sales. What we are still engaging with the ministry is how we can have pre-sales. We have a commitment by groups, and they come in as bulk consignment for certain groups. We have commitment by philanthropists or donors who may want to buy, and we can donate it to the government kitty so that we have more people vaccinated. And having said that, if any one of you is interested in donating or have an idea of getting 60,000 vaccines donated to the ministry or the counties, please come forward, because yesterday on my dialogue with the CS on a call, we thought that rather than re-exporting the good quality 60,000 vaccines that are at JKIA, let's think of a way we can retain and save or give more Kenyans without having retail sales of 8,000 and 10,000 and going to clinic purchasing. That's what creating a mess. So if any one of you is interested or has an idea on how we can do this 60,000 odd vaccines before they expire, please let us know. Next. As we move on, we've had a good MSF. I want to thank FBOs, CSOs, the HENETs, CHARC, KCCB, SUPChem, MEDS, and all the parastatals. Next, we had a good MSF, and I think it was really good. We had an open conversation with Kas Rashid, and we talked about NHIF. I think we laid it on the ground about how many of our members have been waiting for accreditation and contracts not being done. We were assured that it's being done by media, and all those people who have additional services or are waiting for accreditation. Peter Camunyo, who's also, understands how KHF operates, being on our board, was there. They also talked about accreditation of or paying bills on time. The debtors issue was also brought about. But I think one thing I do want to tell members that came is what we call list of shame. And I think we as members must support what we call list of shame. This list of shame, we need to publish hospitals and facilities that may be engaged in fraudulent practices to take on more claims from NHIF. If any of those exist in Kenya, we shall list those members and have them also posted on a website if necessary. If any of our members are found to be in that fraudulent list trying to make more money of NHIF just because of launching more claims, then we should take necessary steps. We were open about this because when NHIF says that providers are actually giving 40% fraudulent claims to this country, we are not very amused. We keep receiving those kinds of statements that are not really appropriate to some very good private sector hospitals, clinics, and facilities. So let's separate them. And we have challenged NHIF to give us a list and not have rhetoric around the fact that they are all thugs who are running private facilities and overcharging bills just for claims. And those who are, none of us at KHF want to do business with those kind of people. We also talked about the COVID-19 vaccination rollout. I've mentioned that to you earlier. Multiple regulation. I think this is a matter of urgency. KMLLTB and PPB, not only are they double charging on various reagents and things, but it's delaying the business consignments of many of our members, and we've ironed that out and given that as a concern to the ministry. I'm hoping that when the committee updates come, the instruction from CAS was clear to sort this out. UHC enrollment, we wanted to make sure the private sector role is clear, and I'm sure we'll hear more about it, and we'll also hear more about digital in our committee reports. Let's move on to the next slide to see what we have achieved. And yeah, I think, Anastasia, you've been quite busy, and you've done a lot of work in so many counties. You can see Alfred Mutua here, who is the Governor Machakos, and this was a great joint initiative between KHF, Stanbic, and KEPSA, and I'm hoping these PPEs will protect lives of many health workers in Machakos. Next. There has also been work, as you can see, jointly being appreciated. Thank you, KEPSA, also from being there. I think this is the Deputy CEO, Cheruto, who was with you. Thank you for being there. Next. This is, yeah, just the proof of the goods that went there. Hopefully, I'm sure it will be made to good use next against COVID pandemic. Good visits also by supply chain committee. That is, Vinod and Anastasia went to see CAS, and these courtesy calls are important to prime leadership about multiplicity of charges and some of the charges that we can do without with. It can remove the cost of doing healthcare. And we are always being blamed by Parliament and Senate. Why is private sector so expensive? Why is it out of reach for so many people? And, there are some hidden costs and multiple costs that we can remove and pass on the saving to the patient. Next. As I mentioned, it's such a pleasure today, and I think this is going to be a good time for me to bring in the 1 minute or 2 minutes. I don't know, Anastasia, are we giving a time limit to each candidate to speak to us and the membership so that we get to know them a little more? How much time are we giving per candidate?
I think 7 minutes would be good. One. And number
Okay.
two, Amit, Stanbic is ready for the presentation. So I think we hear from the candidates and then we invite Stanbic and then we go into the committee presentations.
Okay, so Stanbic, we appreciated you quite a bit. So after the candidates, you please come in. Look, I think you don't have to take all 7 minutes. These are 6 super candidates who are going to speak today. If you can time 5 minutes, it's great. Let's move to the first one. I want to invite on the stage the candidates who are in order. So before I invite them, I think this is just to show you that this board is there. We went through the whole process. 4 of us are stepping down next. You're showing me the governance of the whole election process. We showed you this and all the forms we all saw in the board. Everything was clear. And I think all the ones who did not make it, we informed them. Whichever were erroneous or didn't qualify as nominations, we informed them. These are the vacancies. So it's really good because we've got positions in all of the 4 sections. Next. So chairperson, 2 corporate director positions, and so on. And then we've shared this slide with you. Myself, Faith, Joyce, and Jackie Kitulu are stepping down. So 4 of us are stepping down. And Wala, Jakudol, Walter Obita, Francis, and Daniela Munene, 5 directors, still remain on the board. What a nice balance. Amazing. So welcome to the new members, new board of directors that will come in next. We had transparency. Let me just mention, we had a big debate at our board about how long we keep online voting open. And you can see there was a, should we have it longer, shorter? There was a thing about let's have it longer, but please save the dates on 24th, 25th, 26th. Why? Because we don't want any cyber hacking issues around accountability. So it is a short duration. All you have to do is to press vote and you'll be able to vote. Remember, 1 vote, 1 member. As a company, you have 1 vote. As an association like KMA, you have 1 vote. As Federation of Pharmaceutical Manufacturers, you have 1 vote. You have 1 vote per 1 institution, and that is what will be counted to give the winning candidate a seat. Next. This is again a great pleasure. Let me invite the first nominee, and the next slide leads me to introduce Dr. Kanyenje Gakombe, who is a real close friend and a buddy. We studied together, and he's an unopposed candidate for KHF board position. Dr. Gakombe, the floor is yours. Please welcome and give your address. Asante. Can you hear us, Gakombe? Are you able to unmute?
Yes, I have. Thank you.
And yeah, perfect. We can see you very clearly as well. Go ahead, Gakombe.
Thank you, Amit. And I want to start by thanking you and the outgoing board for the service you've given over many years. I know you go back all the way to the beginning of KHF when we are starting the Kenya Healthcare Federation many years back. Secondly, I want to thank the members for giving me an opportunity to serve them, and especially for not having to go through an electoral process because elections in Kenya are difficult things. And I want to wish those candidates who are still going to campaign a clean campaign and good outcomes. Thirdly, I want to say that this for me is an opportunity to serve. I know KHF. I was there in the beginning. I know KEPSA. I was there in the beginning. and I know we have a lot of work that needs doing. There's a lot that has been done over these many years. There's a lot more to do, and I pledge to serve members to the best of my ability, to work with the team, and especially to ensure that we address those cross-cutting issues that affect all of us who are in the value chain, the healthcare value chain. I believe we'll accomplish a lot with the Secretariat and the rest of the board. And I want to be judged on the results of what we achieve. Thank you. I would like to stop at that point and leave the candidates who need to say a lot more than I to get the opportunity to do so. But I'm really happy to be on board and to serve the esteemed organization that KHF is. Asanteni.
Thank you, Gakombe. Thank you for those words. And I can tell the members I am absolutely confident with Gakombe's history and Gakombe's network, and most of all, his knowledge. It'll be a delight to see Gakombe take KHF to the next level. I urge you to give him the full support as you have been giving. And to the members who will be serving with him on the board, I can tell you one thing, you can hit the ground running because he doesn't need orientation. It's to just switch on and roll with the flow. Thank you, Gakombe, for those opening remarks and literally your coming forward to serve the country and the nation and the members in the health industry. Let me now move to our next candidate, who again, just like Gakombe, falls into the unopposed category of professional associations. And it's a delight, actually. We've been having nurses, we've had pharmacists, we've had KMA with doctors, and this is, I think, a great first where we have the Kenya Dental Association, led by Dr. Linus Degwa, who you all know has a sterling record in the health industry. He will now speak to us and say a few words as we welcome him to the board taking the director's position of the professional association seat. Please welcome Dr. Linus Degwa. Over to you, Linus.
Thank you, Amit, and good morning, members. As I've been introduced, my name is Linus Degwa. I'm the current president of the Kenya Dental Association and also a board member of the Kenya Medical Practitioners and Dentists Council. First, let me take this opportunity to thank the previous board for the fantastic work we have done. In terms of visibility, I can all agree that KHF has played its role in terms of advancing the interests of its members. Mine is to also assure the members that I will be there to serve the interests of the members through the various sectors that I play a role in. I also am a scientist at Kenya Medical Research Institute and also own a private practice. So wearing many hats will enable me to be able to connect with the members as much as possible. As you're all aware, majority of our members in the Dental Association are in the private sector. So a lot of these issues are cross-cutting. And so we will be there to ensure that we are able to work together and ensure that our members' needs are met. Let me stop there because I believe, as has previously been said, there are other candidates who will need more time to speak. But I look forward to working with the team that is there currently and the new team that will be there. Asanteni.
Thank you, Linus. We are very happy to see you coming forward, and Asante, literally to put your name in to serve again. We think that the teamwork that you are creating in the new board will be truly amazing. I want to move to what we call corporate members. We have 4 nominees, and you will be required to vote for 2. When you vote for 2, the additions of the ballot to the 2 highest majority will be given the admission to the board as directors. So we have 4 very strong healthcare candidates. We have, and it's good gender balance. We have 2 men And I think we have two ladies who will now speak, I think, for 5 minutes each to speak to the membership and tell us why they would like to be taking this board position. Let me welcome the first candidate is Vinod Guptan. He is the CEO of MedSource and he will speak to us now. Welcome Vinod to the podium.
Thank you, Dr. Amit. Greetings and good morning to everyone. It's my hope that you and your families are all well and in good health. Like mentioned, I take this opportunity now to officially and in person declare my interest in the position of the Director Corporate Representative position in the upcoming KHF elections. Having been in this industry for over 28 years in the same supply chain, pharmaceutical, medical, and technologies, having handled operations in Kenya and many countries within the African continent and Europe and Latin America as well. I have worked with Kenya Healthcare Federation in specific for over, I think, over 15, 16 years now. And this is a moment to look into the future for me with a hope. So my priority focus areas in this mandate, if elected, are operationalization of public-private partnership, leveraging on the sectorial efficiencies, championing for an enabling business environment for our members through responsive policies, fostering value delivery to our membership, and also integrating sustainability principles in the Federation through human capacity development. And of course, efficient futuristic operational structures that together with the other board members and the chair, we will put in place. So in my representation, I commit to integrate the private sector in promoting access to quality healthcare services and products to Kenyan through the operationalization of, like I said, PPP across the entire healthcare continuum. That is strategic directions, policies, service delivery, supply chain, where my main strength is. And another strength that has come in is in terms of the integration of the IT solutions in the country. We can make KHF be a trusted partner for the government in delivering on their commitment of Uhc mandate. So I would say with me getting up here with your support, we can do it together. Our federation is here to serve, and it is set to serve the membership and contribute towards improving access to quality healthcare services and products to Kenyans. To achieve this, we have to improve operational efficiencies, build up internal capacities to be able to respond and to meet our membership needs. In running for the Director Corporate Representative position, I aspire to help realize this by making KHF a one-stop shop for our private sector players, and thus growing the resource pool through the membership, strategic alliance, and brand credibility in the healthcare space. So having worked for all these years, I would want to move on to a higher level and support it at that level coming down and build up a more stronger foundation for our Kenya Healthcare Federation. So please do support me in making this a reality. I request for your support in terms of your vote and urge you to commit to work with me in making this a reality. Thank you very much. Over to you, Dr. Amit. That's a small synopsis from my side for the members to know me better.
Very clear, and I really am delighted with this opportunities every candidate is getting. Let me now welcome our second candidate to come to the podium and speak to us. And our second candidate is Sophie Hodder. Everyone knows about Mary Stops Kenya. They are in the front line of many initiatives in the reproductive health. And Sophie is interested and has committed to corporate representation at KHF board position. Sophie would like to invite you onto the stage and speak to the members about your aspirations on this position. Please welcome Sophie. I'd like to confirm that if Sophie is with us and able to join, and Anastasia and Leah, you can confirm with me that we do have Sophie with us today or unable to join today, which is also fine. I don't see or hear Sophie. Anastasia, do you have any report? Is it an apology?
Not yet. So you can move to the next candidate as we reach her out.
Of course. Let's do that. The candidate number 3 on your screens is Cynthia Kahumbura, who is from Jacaranda Health Solutions. Many of you who've met Cynthia will know that she spent quite a bit of time in the health industry, and today she actually gives her name to serve as corporate representation as a director on KHF position. Cynthia, we welcome you to stage, and this is an open time for you to speak to the members about your aspirations. Cynthia, over to you.
Thanks for the introduction, Dr. Amit. Good morning, everyone. As Dr. Amit said, I'm Cynthia Kahumbura. I'm the Director of Operations at Jacaranda Health Solutions. I'll keep this quite short and brief. As we know, 80% of Kenyans do not have access to health insurance, hence the need for UHC. We need to adapt and change the way healthcare services are provided in Kenya and how private sector partners with the government in order to achieve UHC for all. This can be done by disrupting the way we provide quality health services, and the solutions sit here with KHF members. I plan to focus on driving the agenda on quality healthcare service delivery at all levels of the healthcare ecosystem. This includes the use of digital solutions to, one, empower clients to know when they need to seek care and what access to services are available to them, building technical and infrastructural capacity for healthcare providers in public and private sector, and 3, effectively influence policy frameworks to drive the essential inclusion of the private sector. And what does this really mean? We need to create financially sustainable models for public sector public-private partnerships. And this will be done through strategic positioning of KHF members and the wider healthcare industry stakeholders. I've had some years of experience in the healthcare industry, but my main focus has been over 15 years of experience in strategic marketing and planning and in entrepreneurship in the public and private sector for startups, growth organizations, and as well as multinationals. One of my key strengths is being able to identify different opportunities from multiple stakeholders, leading to strategic partnerships that can provide sustainable and impactful solutions. So really looking at the variety of KHF members, leveraging relationships and really positioning ourselves for public partnerships as one and leveraging on each other's strengths. My marketing experience also enables me to communicate complex solutions in order to get buy-in and collaboration with strategic partners. So if you want disruption, vote for me. Thanks.
Thank you, Cynthia. And also your message is very clear to the members. And it is now my pleasure to invite our next candidate, who's also put in the name to serve KHF as a corporate director representative position. If you move to the next slide, I'd like to invite our next candidate, who is Isaiah Okoth. Isaiah is also very well known in the health industry. He is at Farm Access Foundation, and he will tell us about his aspirations on his role if he comes on the board as a director corporate representative. Please welcome Isaiah on stage. The podium is yours, Isaiah. Over to you.
Thank you very much, Amit. And I would like to first take this opportunity to thank the chairman and the board members, I think, for the great job you have done. Having been at the initial stage as a founder member, because I remember we used to meet sometimes in my office way back at the beginning of 2000, trying to craft KHF. Had by then just moved into healthcare from the IT industry and trying to understand healthcare, and we saw the need to actually come together as a group to push our agenda. So great job you have done. Since then, I think KHF has moved further and has done a great job in terms of, being part and parcel of healthcare transformation in Kenya. Having done all the work and having seen all the work, that your team has done, I feel that, I'm coming into shoes that are already ready to walk. And I would like to put on those shoes and walk with them, because there is already a vision set. The map has been drawn. Some section of the path has been walked, and now we need to walk the rest of the path together with all the members. My background, I'm an engineer, moved into healthcare in 2003. I've been mostly in healthcare since then, amongst others having been an entrepreneur in healthcare with some innovation that, although I sort of exited, but some of the technologies and the innovations that I think I was working on are still very present today and being used across the market. So I'm very happy that some of the innovations were picked up. I then moved on. I was general manager of GE Healthcare. When GE was wanted to set up its healthcare operations in Eastern Africa, they picked me. I came back, started an organization that was pretty small, and moved it from almost the last position to number one, and just moving it and developing it and transforming it. Thereupon, I moved to help Farm Access and CarePay. So been transforming the organization. So I've been both in the NGO sector, non-profit, as well as profit. So I understand all those areas in the healthcare industry. In the process, I've engaged with, whether it's NHF, I've engaged with ministries, I've engaged with county governments, I've engaged with international organizations in that respect. So I really understand the industry. And in the process, I've also made quite a number of KHF members. I'm putting in my candidature because there are certain things that I believe in that we can truly transform to achieve healthcare for all and affordable. And that is NHIF, which we need to support and also participate and contribute towards transforming. Remember, NHIF is going through a major transformation as it becomes the major delivery of UHC. And in that transformation, we have, for example, informal sector being mobilized to join. We have indigent population being paid for to join. And in the process, we need to look at NHIF to transform NHIF into a social insurance that caters for all, but also represents and has representation of all. So if you look at the board members of KHF today, you are missing the indigents, who are actually a big part of our population, and you are missing the informal sector in its representation. If you look at the devolution of care and how NHIF operates today and how we're operating today, I think there is still some work that we need to do in terms of not only devolving the supply of care, but also devolving the financing of care. So those are some of the things that we are going to look at. The second point that we need to look at is continue the digitalization or digital transformation path that I started in 2003, meaning how do we work on the service delivery? How do we work on the financing and digitize the whole financing concept to create transparency, efficiency? How do we move towards service delivery? And one of my fellow candidates has mentioned supply chain, very important in terms of looking at, how do we transform supply chain so that we have a similar seamless move that we have just had with vaccines, where you can trace products or even, supplies from beginning to end, from where they're manufactured to who they are administered to. The next thing is quality. How do we standardize and institutionalize quality within a healthcare delivery system and make it affordable through digital platforms? The third area that I would really like is the growth of the industry, and that is encourage investment, local investment in healthcare. Why do we have people investing in real estate meant for hotels, but there are no real estate investors who are investing in hospital facilities, so that we have, anchor or even operators of hospitals actually taking up buildings similar to hotels and running them. We need to mobilize our local investors to invest in healthcare facility. And if anything, if Corona has taught us anything, it's the need for us to build local capacity in everything, from vaccines to our service delivery to even specialized treatment. We need to have it local, because if something like that happens again, we may be caught up here without any options, and unable to service our people. Access to loans for those people who have now, invested and want additional money to continue their business. We need to emphasize that, and with this, really encourage the SMEs that are run by women or led by women for that matter. Expansion of mobile loans for cash or for working capital, which has been a major issue, things that can be done quickly. That's something that we need to expand, but all of these things need to be affordable. They need to be concessional, not at bank rates, because that's what is hindering the progress. And finally, I want to ask all members to vote for me, because I'm visionary. I know the industry. I know what we need. I joined healthcare because of self-interest. Why self-interest? Because I'm a beneficiary for both public and private healthcare. So vote for me, because I'll bring the collaboration together, because I know what it means to provide care. Care has to be provided by both private and public, and we need to bring all the parties together, both from financing and service delivery. Thank you very much. Back to you, Chairman.
Thank you, Isaiah. That was quite comprehensive. You have drawn your plan, and your message, again, like all the candidates, is very clear. Let me congratulate all of you, all 6 of you. 2 who are already going to be incorporated in the board, when the ratification of AGM in May happens. I also want to congratulate all the 4 candidates. Regardless of the results, you are all winners for the health industry in Kenya. You will continue to serve. Whether you come on the board or not, service still carries on with the members who are also here. That's the spirit we've been cultivating in KHF. I want to now hand it over back to Anastasia for the second half of the meeting. I will join you, Anastasia, at now the AOB. If you can take over for Stanbic presentation and committee meeting presentation, I will rejoin you at AOB. And I also want to recognize the presence of Dr. Wala, who is our vice chair on the meeting platform. Anastasia, you can call upon her should you need to. So let me invite Anastasia to take over the program from here. Anastasia, over to you.
Thank you, Amit. Sorry, we just got a small hitch on our network, but it will be fixed soon. But as we continue, I would like to invite Esther to make the Stanbic presentation. Esther, the floor is yours. Esther, you can hear us?
Everyone? Yes, I can hear you. Can you hear me?
Okay, proceed, yes, and share screen.
Give me a minute as I share my screen. Good afternoon once again to everybody on the call. My name is Esther Nduku. I work at Stanbic Bank, and I'm sure we're not strangers to you. We have been in partnership for a while now. And just to give you a bit more detail about myself, I work in the brand and marketing team, and I largely look after the brand, the foundation, and the sponsorships the bank gets involved in. And here representing our head of foundation, Pauline Bayer, who's really the steer around everything that the foundation does and has been very instrumental since we launched our foundation last year. She was otherwise engaged, and I will be doing my very best to represent her and just speak to you about the partnership that we have this far with KHF and where we're looking at into the future, and as far as this partnership is concerned. So I just wanted to set the pace for what we're about and what we've been doing. There's a lot of work we've done this far with KHF and with a lot of other partners. And just to establish what we are about, if you look to the left, we then position the foundation as one that is looking to partner for growth. And the idea of partnership is very real for us because we realize there's a lot of work to be done and we cannot do it on our own. We definitely need to work with partners, and we have been looking and been working with partners across different industries. When COVID hit last year, we did reach out to KHF to understand how we could work with the Ministry of Health in terms of being of impact at the point where the country really needed help the most. And because there was a really great need in terms of ventilators, it's not a task that we could do on our own. So we actually reached out to our clients to say, can we partner for this? How can we make a difference in the country? And we're able to mobilize quite a number of our clients and our partners to raise 147 million and donate 194 oxygen therapy machines, which were distributed across the country. And for us, with every initiative where we then do partner with others, it's very clear that this is the model that we're going to adopt going forward. Maybe just speaking to health a little bit more in detail, last year, again, we did manage to partner with PSK, again, a lead that we got from our partnership with KHF, and we did carry out quite a number of breast cancer screening awareness camps in the month of October, just really observing Cancer Month in October. And it's a partnership that we want to broaden going into this year. So to look at different other types of cancers, to go into prostate, to ensure that we are able to reach at the grassroots level. And the beauty of the sessions we've had, it's not just, sorry, can you hear me?
Proceed, we can hear you, just proceed.
Okay. So it's also about, where the positive cases, there's follow through the clinics that we are partnering with, and that's Tunza clinics. Last year as well, I think for us, when we set up the foundation, and even where we do have physical infrastructure, it was around bringing a lot of SMEs and MSMEs into the physical space to get training. But when COVID hit, then we had to translate that into virtual training sessions. And we partnered again with Wild International to deliver what is called Boost with Facebook, a digital marketing training with a lot of our partners, a lot of our clients as well. And we did reach out to KHF members and were able to deliver training sessions for them. And very, very positive feedback came out of this, because if you think about it, what are we trying to do with this sort of training? It's about helping businesses, small clinics, develop an online presence, an online store, be able to attract new audiences and understand the marketplace, because it was shifting a lot. If you actually look at what was happening last year, a lot of people then moving into the digital space because of the physical lockdowns, trying to find things and services online. So that's a space you really cannot ignore as a business as you intend to grow. So there was a lot of very positive feedback coming out of the people who came in for the training to say they saw a lot of traction online, to say that it's really changed their brand, and there's some growth they're starting to see by being present online from the learnings that they took from those trainings. And then the area of PPEs is something we also kicked off last year. I think it was in November and December, to say, how do we then impact within the front line and be able to support in as far as PPEs are concerned. And we then did our phase 1 all the way into March. We've covered quite a number of counties. You can see on the screen what we've been able to distribute. And after this exercise, we did have an engagement with the Ministry of Health, and and the push we did get is to extend this event further, to not stop here. And we will be working with KHF to look at other counties as well. Once the lockdown has been lifted, we are able to go into even further geographies to ensure that we continue to support the front line. So further to the PPEs, the work we've done around health, it's really around the SME training, which is really close to us. And again, looking at the area of partnerships, what we've done is partner with AMSCO. I believe you probably know of AMSCO, Africa Management Services Company, which really focus on SME development and training in a lot of key areas. And we partnered with them to say, how do we help our partners within KHF in the areas of strategic management and financing as well. So you will see the broad areas that we're going to be covering in the next slides. And just the reason for this and why we got into this is just also understanding of the marketplace, to understand that we were all operating in difficult economic times, and how do we then help small businesses with a great focus with rural and faith-based outlets, and that's where our focus really is. How do we help them improve their cash flow? How do we help them navigate the difficult operating environment that they are in? How do they circumvent some of the quarantine policies that are in place? And what we've done with AMSCO this far is really just do a needs assessment based on the current environment to say, how then do we custom make a program that is right for the partners that we're inviting into the program. So it's really going to be largely around strengthening the competencies of our SMEs, enhancing their financial literacy. And for us as a bank, it's something we've had on our minds for a really long time. We do have a program which we called the Financial Fitness Academy, and we had a specific outreach around looking at doctors, especially in terms of giving them that holistic view around their wealth, and wealth really is a function of quantum. We're not really looking at the top. It's really a function of quantum based on where you are. And the area of investments as well is very key. We realize that a lot of doctors, they really focus pretty much on where their cost strengths are, but these other strengths are also important in terms of being able to run your business effectively. Yeah. So looking at where we are, conversations have begun and engagements have already happened. We're already in contract with AMSCO. The identification process has happened in collaboration with KHS, and we've done the needs assessment, and we're now ready to roll out the program. We are now in the phase of saying the virtual training can begin. And to broadly look at the 6 areas that we will be focusing on. So there is strategic management. Just look at the area of strategic planning and strategic management. Sales and marketing is also very important, and especially in the environment we're operating on. If you look at sales and marketing broadly, there's a factor to your audience. What's happening in your audience, to your environment? How do we adapt? How do we adapt to digital marketing to, obviously improve awareness of our brands and start to build ourselves, in the micro geographies where we're operating? Financial management is really key. And as we go through this program with AMSCO, really the key areas will be around interpreting financial statements, your balance sheets and your cash flows, understanding all that. Because the way we've also understood some of the clients that come to us as doctors from the medical fraternity, they actually have a lot of potential to probably get access to credit, access to asset financing, but because you're not well financially organized, then that sort of, does not allow you to qualify for whatever assets or credit that you most likely would be potentially able to get. The area of governance and succession planning is also very, very critical. If you then think about a lot of these businesses, the way they're set up, and it's by nature of business, is that you do have a key person. And the area of succession is very, very key. And we look at it broadly, AMSCO will be able to look at the different roles of boards and pillars of good governance around businesses. What are the emerging issues when it comes to succession planning and the rules of succession management? Even at the bank as well, we try to look at that to say what are the key assets that then a business will need to build around itself, where the business in itself is largely dependent on a key executive in the organization. Is it around looking at the risks involved and being able to take care of those? So it actually can be very broad. And the way we look at it is to say, post this session, we are actually willing to get back to the table and say, what further knowledge could we be able to engage about and share on, because we do have experts at the bank that largely look after these things. Legal and compliance remains very, very critical in this industry, and that's a key area that they will be covering for this training. And people management as well is critical, because people really are the backbone of any business. So how do you look at motivation, the area of rewards, and talent identification as well? So as I had said, we are now in the space where the training is about to kick off. Trainings will be kicking off from the 14th of May. We do have 3 sessions for each particular topic, and this will run up all the way into December, so into the next 6 months. We kick off in May into the next 6 months. That's how we intend to roll out the program. So that's it from me. I hope it was clear, and I will take any questions or comments. Thank you.
Thank you, Esther. That was short and precise. Thank you very much. Just a short comment that even with the lockdown, we're able to go into those counties. So let's plan accordingly. We've just done with Mombasa with KEPSA. So let's do it. Let's not stop the momentum, because this is when the PPEs are really required. In terms of passes, KEPSA, KHF can be able to help you realize that. So thank you for that. And just for members to know that, the 6 modules starting May 14th, as you've seen, is open to all the KHF members. We will be reaching out to the different institutional association, in particular RUFA. Of course, we will also have bring on board the faith-based organizations as well. So when we reach out to you guys, please do engage, provide your, especially those who are in RUFA and CAF and the others, please get your members to get engaged. One of the things that will also be required is also, access to the internet. So where there are challenges for internet, especially for those members that are operating from hard to reach areas, then it will be one of the things we'll see. How do we overcome that particular obstacle? Because we still need to ensure that we upskill as many of our members as the need arises. So it's likely to be a multi-year partnership. So I would like to thank Stanbic very much for coming forward and looking out for KHF to help bring this upskilling, capacity building to our members. So I'm hoping and praying that it will have an impact for for our members, and yeah, please let's stay engaged. So asante sana, Esther, and we're looking forward to creating an impact for our members. Next, I want to take it back to Amit, please.
Thank you, Anastasia, and thank you, Esther and Pauline, Alia, and all the Stanbic members who we've been engaging for many years to actually make this impactful engagement with the work around the foundation. I want to just make one appeal to members. Anastasia, when is our AGM? Is it 27th, 28th?
27th of May.
27th of May at the same time, again from 11 to 1, I think we shall be able to cover. I'm actually quite glad to report that I've been in touch with the CS who wants to grace us with his presence at the AGM. We need to send Anastasia a letter quickly to him, and we will invite many partners like the faith-based organizations, civil society, development partners. So it's a widely attended AGM. We have a few sponsorship slots for KHF. I think $500 to be an AGM partner, and I think $1,000 to have an AGM clip, whether it is a short video or a small slide presentation. And these two are very affordable and very, very small contributions. I ask you as members to quickly go to your accounts department and start putting that sponsorship form out to Leah and Anastasia. So logo recognition for supporting members, simple $500, and those prize lists I think can be shared and given to you. Let's go do this quickly. We can collect some money to enable also the Secretariat continue beefing up their function. I also want to appeal to Esther. You're still on the line here as Stanbic. We welcome you, and we really nice, and really nice to see your logos and your support for our AGM in this particular time. I would like to now pass it over to our Vice Chair, Dr. Elizabeth Wala, who has joined us to take us through the committee updates as you see on your screen. Dr. Wala, we welcome you to stage. You have a very nice outdoor position right now, and we'll share in your sunshine as you throw sunshine on these 6 committees. Over to you.
Thank you very much, Dr. Amit. Good afternoon, everyone. I am practicing wellness and resilience by changing my scenery from the office to the outdoors. So I'll proceed and go to the next topic, which is on our committee updates, and we'll start with healthcare financing. If Dr. Njoki Fernandez is on, we can go ahead there. Thank you.
Good morning. Good morning, fellow KHF members, and nice to see all of you today. Thank you, Esther, for that wonderful presentation. And you can see I'm in healthcare financing, so I'm very, very keen. I have sent you an inbox. Please look at it. Okay, so this was what we did at the last meeting that we had with Kash Rashid and the CEO of NHIF, among others. It was a very good meeting. And these are some of the things that we raised. And this area of healthcare financing caused a bit of attention, which is, I suppose, what was supposed to happen. Yeah. So I'll go through them very quickly. Is that we were concerned about the proposed NHIF Act. And why? Because mainly of the capacity of NHIF, that they look like they want to give NHIF more work. And we felt that maybe their capacity needed a bit of help. And so these were the areas: pending bills that were owing to the facilities, and then outstanding contracts for services like renal, theater, oncology, and delays in accreditation and contracting, delays in approval of new comprehensive service contracts, and delays in pre-authorization approvals. And then the impact of this is that facilities are nearly closing down, or some have actually closed down under the heavy debt that NHIF owes them. And then it's also an inconvenience to patients because they have to travel far, some of them, because the facilities around them, the contracts are taking too long. And so they cannot offer this service that is required. And then also many patients are spending out of pocket, which impacts on access to care, and it negates the very purpose for which NHIF was created in the first place. And then you see the fact that a lot of capacity, I don't want to call it power, is being given to NHIF under the Act, and this is being taken away then from private facilities, and then they're still not able to manage the work that they're being given. So that is a concern. And so the proposed solution was that we really asked them to settle the pending bills and increase the turnaround time, reduce the turnaround time for settling bills. And then we also talked about innovation and outsourcing contracting providers to improve services and to close out all pending contracts. We know that the contracting process takes long and the board has to sit. So if there's a way we can shorten that process to make sure that as many facilities as possible are able to offer these services to the Kenyans. And then another concern that we had was that previously medical insurance was not covering COVID-19. We know when COVID struck, it was in the middle of an insurance year, and many of the insurance companies had declined to cover COVID. And this was because it was a pandemic, and in many of those policies, pandemics are exclusions, and they hadn't been priced into the product. Also, there was not enough data to help them anticipate what the cost of care for COVID patients would have been. And this led to the high cost of treatment for COVID-19 impoverishing citizens. And this is something that we are still seeing today, that we are doing a lot of fundraising to support our patients who are, especially the critically ill ones with COVID-19. And so the proposed solution was that the government should create a policy document on medical insurance for pandemics. We have also seen that many insurance companies, now that we have a bit of data, the actuaries are actually able to price cover for COVID-19 and to put a premium out there for it. And many corporates and many individuals, as they're renewing their insurances for this year, are able to purchase COVID, some level of cover, which means then that the patients are assisted to some extent. There was also an advisory that was issued by UHC last week or 2 weeks ago, advising insurance companies to pay for vaccines in anticipation, I suppose, that then when the private sector does bring in vaccines, people will have to pay for them. And the thinking behind this is that prevention is always better than cure. You'd rather pay for the vaccine rather than pay for the cost of treatment. And so that advisory was given out by UHC to its members. And let's see what the reaction from the insurers is. And then another area of concern that we raised was the Uhc Enrollment Scheme, that it's not very clear, and we're not sure exactly, we're not quite clear on what is going on when it's been rolled out, which are the counties, what are the diseases being covered. And what then happens is the disease burden may skew the health gains of the past, and there are high bills being incurred by vulnerable patients. I think we've so been swallowed by COVID that we've forgotten that there are very many other diseases that are still affecting our vulnerable patients. And so we requested that we would have private sector involvement in the Uhc rollout and involve private sector in the Uhc technical working groups, so that then we are able to also offer the expertise and the resources that private sector has, and we can also benefit from the Uhc rollout. I don't know if there's another slide. I think that was it. If there was no other slide, yes, that was us, healthcare financing. Thank you.
Thank you very much, Dr. Njoki. We move on to supply chain.
Thank you, Dr. Wala. Good afternoon, members. So as a supply chain, there's a lot more than what has been shown here on this slide. But these are the few pointers that we would like to pick up and bring it to the immediate attention of the members on the task that supply chain took and has probably completed or has reached a good finalization stage. So there were multiple issues. I would only present three of them. So one was a regulation issue of having multiple regulators regulating the lab equipment and reagents, most so specifically by KMLTTB and also by PPB. So this, of course, we presented this, and like what was mentioned during our chair's report, myself and the CEO, we went and had a very candid conversation with the CIS and explained to him of how it is going to impact in terms of the increased cost of care, the increased cost of doing business, and also it was not in any way helping the ease of doing business in the country for the people who are involved into the importation and distribution of the equipment and the reagents. So it has culminated into a meeting between both these regulatory bodies. The Ministry of Health and the CAS is all quite clear, including the DG, that it is one single regulator, and that is PPB. So within the framework of the legal framework, there is a loophole that KMLTTB had, and that is what was pointed out in terms of it being able to regulate or look at the products. However, PPB and KMLTTB senior management are now having conversations among themselves to try and see the best way resolution for it. So what we have proposed as a solution is to revoke the legal notice of 113, which went way back into 2011, for it to now fall into place so that there's one single regulator. We also have requested to nullify the KMLTTB circular of 21st December, which was now making it mandatory for people to go and register the products and also be regulated by KMLTTB. So this would hopefully fall in place once PPB and the KMLTTB management have spoken to each other and a way forward has been charted. So the number two issue that we picked up was the importation and supply of COVID-19 vaccines in the country. It has been very slow by the citizens, and like some of my presentations has been mentioned by the chair in his introductory remark, with a lot of publicity campaigns, the vaccine offtake has now reached an appreciable level for people to have now noticed that we are actually running short of vaccines. So we have also looked at the private sector coming on board and importing vaccines. Yes, you have seen what has happened with regard to specifically one kind of a vaccine that came into the country and is now awaiting the way forward on how we can either use it in the country, or probably it may have to be exported back. So there are consultative meetings and engagement that's currently ongoing with KMPDC, PPB, MOH, and the Council of Governors to work out on a very structured framework so that this issue is handled. And also in future, we can have a very nice framework of the private sector assisting the government in fighting this pandemic by allowing them to be importing vaccines, the COVID-19 vaccine, and then probably trying to see a very structured way of how it can be disseminated into the market as well. So that takes care of the number 2 issue. With regard to the third issue, we had local manufacturers who have always been at the brunt and at the receiving end of having very high cost of importation of raw material, coupled with many other issues of the high cost in country as well. So we are trying to put a policy in place so as to strengthen and create the awareness of the national policies on the medicine and medical devices as well. So hopefully in the next reading, we may have something coming up. And this high cost of medicine is definitely impacting the end user, the end consumer, which is in our case the patient. It's not a commodity item, so it's affecting the patient, and definitely it's affecting the UHC as well. So access is denied, and that is one of the pointers that we're making, so that we're able to get some kind of a good presentation made for people to realize and then make healthcare more affordable in terms of the products as well. So we are in the process of providing local manufacturers with the we're in the process of speaking to the government for providing the local manufacturers with appropriate incentive for them to continue manufacturing and grow beyond their capacities with a proper support, and harmonize the taxes for in region for where our local manufacturers are currently exporting to as well. So this is a short brief and update from my end with regard to the supply chain. If there are no questions, Dr. Wala, back to you.
Yeah. Thank you very much, Vinod. So Anastasia has made me aware that many of these topical issues that are touching, especially with our COVID-19 response, are being handled both at the CAPSA level and also at the COVID response team led by CS Matiang'i. So we are keeping tab of the advocacy efforts that are there. Over to ICT and mobile health. ICT, do we have Dr. Turuti on board?
All right,
okay,
I cannot trace him.
Okay.
But I can just
do you want to go over
mention that yes, the digital health bill, we have the draft, we have at the Ministry of Health, they are pushing hard to ensure that we have it out with the consolidated feedback by the end of June 30th. So for those team members or for colleagues who are participating in the health committee, please do provide your feedback. For the rest of the members, the draft bill will be shared with you on the various CareChef platforms, including by email, so that you can review and give your feedback. If you can give us feedback within the month of May, that would be very helpful. But the progress is moving, and we are putting pressure on all sides, at AG, through KEPSA, directly at MOH, at our MSFs, just to make sure that goes through. So I think that's the main focus area for this committee in the next 2 to 3 months.
Thank you very much, Anastasia. We are next committee. There's a question, I think, on the chat that we'll address. Public-private partnerships. Go ahead. Is Dr. Ann Musuva around?
She was around, maybe she dropped off. So maybe I can also quickly take this up. So we have the Wheels for Life project, which is up and running. We're just doing the last month of funding by FCDO, but we are reaching out to other stakeholders and donors to see, what we can, how we can push the program forward. So the partners, most of them have agreed to provide pro bono service until the funding is we have more funding. Of course, and only the ambulances are not able to do that. So the team is trying to see how to overcome that challenge. But so the program will still continue as we look for more funds. Also in the issue of public-private partnerships, we participated also as KHF under the PPP committee, the development of the public-private collaboration for health. So that is what they call the strategy for PPP in services for health. So it's a PPC. And now we are, the awareness and creation and training is ongoing. We have training of trainers who are from, including Kenya Healthcare Federation members, myself and Dr. Walter Obita. So we hope we can scale that up in the private sector as well before the end of the year. So that is in plan and on track. Bit of slowdown because of some delays on the funding side. So, but that's on scope, and the PPP committee is taking care of that. Private sector involvement in the MOH technical working groups. We brought this up during the last MSF, and immediately after that, we followed up and we were given feedback that some of the committees, some of our members who are nominated have been engaged already. Committee meetings. This is mainly the intergovernmental coordinating committees. So in those ones, they had a few challenges in communicating with our members, but now that's going to be fixed and we should be able up and running. But also important is to ensure we are also asking to be involved as private sector in the various other technical working groups. So that is work in progress. We're in the task force COVID-19. We have not entrenched. Well, we are not yet in the vaccination rollout plan, although we have task force, although we have also, nominated persons into that. We also have nominated persons, or have been asked and have nominated our members represent us in other technical working groups of the MOH. So we call upon those, as much as possible, we get engaged at all levels. When we call upon you guys, our members to participate, we would like you to support us, because the more we play in the technical working groups, the more we influence policy, if I may use those words. So that's it from the PPP. We have many other partnerships. Some are on the pipeline, some are ongoing, like the one for Stanbic, which is not yet because it has just started rolling out. So we'll keep you members updated as we continue to have more public-private or private-private partnerships. Thank you. Back to you, Alla.
Yes, thank you very much, Anna. I was requesting Leah to move to HRH. So HRH, do we have Ken Nauma on board? Okay, so I think I can represent this because I am the board member representing the Committee for Human Resources for Health. We've been looking a lot on our COVID-19 response with the health workers, especially addressing vaccine hesitancy. And I think the solutions have been looking at more advocacy around that. We've seen a lot more uptake of the vaccination exercise, given the fact that quite a number of health workers are now going viral with their vaccination images and messages. We are still looking at the EMT bill and policy, which is some work that's gone in, I think it's now at public participation, so that is ongoing. We've been supporting in HRH recruitments in terms of advocacy, and we are now looking more at better management of the health workers. And last but not least is to do with the protection, and I think Dr. Njoki's committee is also looking at the insurance bit. as well as the vaccination. And this requires a lot of public-private partnerships. We are still leveraging on lobbying for more budgetary allocation for hiring of health workers. And of course, we've been at the front lines, as Anna has mentioned, on the being involved in the technical committees that are looking at vaccine implementation plans. So this is going on well, and we look forward to more engagement as we try and advocate for our health workers. Next. Health regulations and quality, is the chair around?
Yes, Dr. Wala, thank you very much.
Karibu.
Asante, asante. So as a committee, some of the things that we've been working on has been alluded across the various committees, like the digital health regulation and the issues of multiple regulation of the lab reagents. So we've been working with various committees as well. But something very critical that Dr. Amit, our chair, already alluded to is our role in terms of the vaccine distribution and the regulatory issues. And what has been very good is the private sector has really played a critical role in terms of the vaccine distribution at no cost, already, as Dr. Amit alluded. And so far, we've not had any anomalies in terms of quality issues from the private sector. Neither are we also receiving any much from the public sector. Regarding the regulatory issues, there has been hesitant. I think this has been common, confusion of the general public regarding the vaccines. But as we look at it, we have already seen that majority of our directors and our team have been put as part of these technical committees to work together with the public in terms of enhancing this and supporting. So that something that is very critical is having a communication plan that is really robust. So that is work in progress. It's being done, but much can be done still as well. And again, in terms of safety monitoring and surveillance in the private sector distribution centers, this is going to expand as we progress, as Amit alluded, at a fee, if possible, for the administration. Again, something critical is the issue of weak regulatory framework and lack of enforcement, enabling operators for unregistered professional and facilities to continue operating in the sector. This is something that we've been keen on, and looking at how to strengthen the regulatory boards within MOH. So we have been pushing during the last ministerial stakeholder forum. We're able to push for involvement of the private sector as an observer and to ensure that this is happening in order. I need not to repeat anything much. I think that's it from our committee. Thank you, Dr. Wala.
Thank you, Millicent. I think that's it for the committee reports, unless I have missed one. So I want to encourage members that you can plug into these committees, so they're not a preserve of the few. And so for you to plug in, please reach out to the secretary, to the committee that you're interested in, and they'll be happy to make the connection with the different committees. Over to you, Anastasia.
Thank you, Dr. Wala and the committee chairs. We now just give you a brief update on the upcoming events. There, next slide. Okay, so we have this coming up. You can see the dates. Next. Next slide. Next slide. Next slide, Leah. Okay, so I think, okay, so we did mention this in the last meeting, and this is from Strathmore. You can see the dates. We will share the slide decks, but you can have more details. Next. Okay, we have the AGM coming up in on 27th of May. Please mark the date. We will send immediately after this the voters register. The voters register will have the organization names that are paid up. Currently, we're at 130 so far. And also within that, we will have the name of the main representative and the alternate. But for data privacy reasons, we will not provide the emails and the phone numbers. This is just to make sure that all the candidates and all the members have the updated list of those who are eligible to vote, and so they can do whatever they need to do to to campaign and get the necessary voting. Now we will have e-voting, and we will provide you details as soon as of the registration and how to vote as soon as that is up and running. We should be ready to do that during the course of next week. We expect on Monday that the returning officer will look at what we have in place and confirm that all is good to go. Next. Okay. Those are our members' events. You can see 9th of September, we have an AHB event, 21st of October, another series. 10th of December, we have our health sector roundup. Next. This is put here just for information, and as Chairs mentioned, we will have a meeting on Monday just to speak with the various stakeholders, MOH, Kenya Bureau of Standards, so that we have a policy framework on emergency use authorization for industrial oxygen where there's a shortage of medical oxygen. Next. Okay, projects, let's go. So we're currently running the multi-stakeholder partnership phase 2 that has kicked off between Malteser, AMREF, and Kenya Healthcare Federation. It's funded by BMZ. Next. We have mentioned Wheels for Life. So we have reached around 100,000 mothers now. The statistics you see there, they're a bit outdated, but we continue to reach more mothers. Next. We also have the regional project that is funded by Bill and Melinda Gates, coordinated from KHF, but under the East African Healthcare Federation umbrella, and 5 countries are running independent projects under the leadership of, the funding is coming through the Africa Research, AERC, Africa Economic Research Consortium. Next. We also have All-M, who we have been supporting with the linkages in the countries, and they plan now to set up shop locally, and we hope to continue the collaboration on a phase 2, which will be deeper than what we've been doing currently. Next. Back to you, Dr. Wala. Thank you.
Thank you very much, Anna. So we've come to the end. I think, Anna, there are a couple of questions. Maybe we can address them before we close.
Yes, we'll do that. So the first one is from, I'll start from the bottom. So we have from Rohini, he says that he hopes that BOC is included in the oxygen meeting. Yes, they are. We have included all the oxygen manufacturers, all the medical oxygen manufacturers in the current, what do you call it? The current, the ones who are registered by PPB.
Medical gases. The medical gases group.
Yes. All medical gases. So we have a medical gases group. So we've invited them. We also have a hospital group. We have invited them. And we have invited the Kenya Bureau of Standards. PPB has confirmed. KEBS has also confirmed. The Ministry of Health COVID-19 subcommittee on oxygen will participate. and the COVID-19 task force has asked that we reach out to the ministry to ensure that we get it. KMPDC also will be in that meeting. So indeed, yes, that's the answer. Which is the other question? When are we anticipating the COVID-19 private sector framework to be ready for use? This is the one on vaccination, I guess. So by me, it was supposed to be 2 weeks since 2 weeks ago. So we expect that by end of May, we should have it up and running. So that should be the timeline. So let's work with the timeline of end of May. Then the other one is...
Anna, sorry, CEO, yeah. Madam CEO, I have answered most of it.
Okay, fine. That's okay. I think the BOC. Okay, fine. So thanks. Back to you,
Okay, thank you, Vinod, for making our work easier. I want to appreciate the Secretariat for putting together this meeting, for everyone attending right to the end. And I want to invite you, I think the Secretariat will still send out a reminder of our timelines in terms of the voting. I want to wish every candidate the best. And our AGM will be held in May. We are hoping to have a blended session where there'll be some physical presence of some of the two different boards, and then the rest of us can tune in online. So looking forward, please put it in your diary. It's a great milestone when we are changing guard. So without further ado, I want to wish you a good afternoon and the rest of the week, and let's keep on discussing and chatting and plugging into our events. Thank you very much and have a nice day. Bye.
Thank you. Bye for now.
Bye. Bye. Don't log off yet. There was another slide. Let me move to the next slide. I will see the ones who just know.